What's going on, guys? It's Pat and Cam, and we got a very special episode. We're going to be talking about all things down there. Welcome to the Men's Health Unscripted podcast with Patrick and Cam.
We're focusing everything on men's health, look at your emotional, your physical, and your spiritual well-being. You're going to take care of that and make sure you keep on going.
With Dr. Fenwa Milhouse, co-founder of There Urology and star of Dr. Down Below on TLC. Dr. Milhouse, great having you on the show. I think it's been a long time coming. How you doing?
I'm doing well. Thank you for having me, Patrick. Thank you, Cam. I think it has been a long time coming. We have chatted offline multiple times, and I'm excited to get into discussion today.
For sure.
Yeah, we are pumped to have you on.
Yeah, I think there's a lot of crossover in what we do. You are a urologist, and you talk a lot about men's health, and having men come into your office, and they're like, "Whoa, I get this female urologist." So, tell us a little bit about that, and just kind of your experiences with men in general in healthcare.
Yeah, that's kind of one of the joys a little bit. It makes it for not a dull day in urology for me personally. I did this little video on TikTok recently where I'm like, the men who see a woman urologist, and it's like the different types of men and their responses. The ones who don't do any, who don't realize and Google me before, there's a little bit of a shock in their eyes that you can see a little bit, or just a surprise. Milhouse doesn't make you think you're going to walk in and see me necessarily. And most of it, fortunately, most of my interaction with men, with my male patients, has been positive, has been great. I think even the ones that are a little bit surprised or maybe gun shy, which is completely understandable, maybe feel embarrassed, especially because of the things that I have to discuss with them often that has to do with their penis and sex. I think by the time, within a few minutes, they realize that they're sitting in front of, one, a professional, and two, somebody who is there as a compassionate ear, somebody who's non-judgmental, and somebody that they can talk naturally to. I tell my male patients, just talk to me naturally. You can use the terms that you want to use. You see what I'm saying? I think when they hear me use the terms just tell me, talk to me plainly about your dick. You can say these words. It's not going to offend me, but they're like, okay, fine. Now I can be, more myself, and to try to help them. So.
Oh yeah, I could see that definitely being a big concern because, historically guys don't want to talk about health with any provider at all in the first place. And then it's kind of ironic because The Simpsons was actually just on the TV here behind me. And, popular character on Simpsons is Milhouse, and it is a male character. So it's kind of like what you think in the back of your mind. So it is kind of good that you're kind of open and allowing them to be a little more comfortable, because that whole white coat syndrome is something that is kind of a serious issue when it comes to not just talking about conditions, but also masking potential issues or causing spikes in blood pressure, things like that. Yeah. So it's got to be a huge relief to walk in and your doctor's like, "Yo, what's going on with your dick?" That's got to be such a opening statement, and it's impactful in a good way. It's not off-putting, especially for most men. So it's got to be some very good tools to be using.
Yeah, you have to know your audience. And at this point, I understand enough about my male audience that you're right. For most men, going and saying that is not off-putting. In fact, it's oh, okay, yeah, now I feel like I'm more comfortable. So, and that's important to me. I think for any urologist who does this, especially if you're dealing with men's sexual health, you kind of have to have the type of personality that people feel open enough to talk to you about their dick, so you can't be too, you can't take yourself too seriously, and you can't be socially awkward when you're talking about this stuff.
For sure. I know, there's a lot of people that are like, I don't want to go to, especially the urologist. I mean, I have older clients, and immediately associating with the urologist are somebody's going to stick something in my pee hole. I don't like it, and I think that to a degree in urology, there's probably a lot of poking and prodding, and and patients they just don't want it. Right.
Yeah.
So, what are some ways, speaking of making patients more comfortable, what are some ways that you get your patients more comfortable with maybe uncomfortable exams?
Procedures and exams. Yeah. Um, First of all, you have to prepare them mentally. I talk to them about what's coming. Most of the time, we don't necessarily have to do the poking in the pee hole the same day that I meet them. So they have some time to think about it, which maybe means that some of them don't come back. And I explain to them that, it's going to be quick. We use lots of lube, and I try to be gentle. Okay. This isn't just another, I don't want the patient to at any time feel like they're just another number, and I'm not gentle. And I listen to body cues. I talk throughout the whole thing. Okay, now I'm going to do this to your body. You see what I'm saying? Now I'm going to put this here. I'm going to do this. It's really important that people know what's happening to their body so they can make a decision throughout the procedure. Somebody might say midway through, like, stop, don't want this. And I have to oblige. The other good thing is I have really, really good staff. My medical assistant just has a good way of like making patients feel comfortable. So it's a team effort here. There's never just me in the room when most of these pokings are happening. And so my team member, or medical assistant in most cases, like, she's really helpful in adding to making patients feel comfortable. We do things like play music during, okay, I'm going to put some, put music on. We have TVs in our room too. So we really try to create a vibe that is like as relaxed as you can be for something like sticking a camera in your pee hole, for the patient. Yeah.
Yeah.
That's quite like a drastic change of pace. So like for those of us and our listeners who are military, we call it punching the bore. And typically they threaten you with it more often, and it's not like a comfortable thing. They're not like, oh, we're just gonna be gentle, we're gonna be nice. Like you'll be in the squad bay, the sick bay for it, and it's kind of like a cliche like emergency room where you have the bed. There's like 6 beds in an open room. They have like the little curtain pulls, and they don't close the curtains all the way, and they're inviting other corpsmen over during it. It's an awkward thing, but it's a good draft comparison when it comes to civilian stuff compared to military things. So that's got to make people feel a lot more comfortable, especially when you're not talking to them like, yo, you dirty motherfucker, this is your fault. I got to do this. I'm sure that definitely helps.
That helps a little bit. Yeah.
So when you first meet a patient, like what are some things that you, I guess specifically with men, that you might encounter, and some hiccups maybe for our viewers that are hesitant to go to the urologist or might know somebody who needs to go? What are some things that you would tell them to kind of encourage them? Maybe things could get better if you catch it early, that kind of stuff.
Yeah, I mean, the biggest thing, I think that 2 things that are important in men's health that we see in urology that I think are important. One is prostate cancer screening. November is next month. I think last month, September was prostate cancer awareness month. And so with the prostate cancer screening, it's the dreaded rectal exam that I think is really the big component of like what puts fear in some men about going in for that. So, I think it's important to first encourage men that it just starts off with a conversation. Like, you're not obligated to do anything, but it's important to at least be informed. What you don't know can hurt you. Okay. And so you don't want to be uninformed simply because you're like, I don't want anybody sticking their finger in my butt. Fair. Let's sit down and have a conversation. And so before I do any prostate cancer screening, it's a conversation. And then I explain to them, part of it is a rectal exam, but part of it is a blood test. And I would say 90% of them, by the time we've had the conversation, realize the utility and are like, let's proceed. Maybe 10% of them said, you know what, doc, I don't want to do the rectal exam. And that's fine. That's okay. I'll just do the blood test and I'll meet you where you are. You know what I'm saying? You have to meet the patient where they are. So that's one aspect. The second one, in my field, that tends to be a common embarrassing issue that may have men struggling to go get seen is erectile dysfunction, or, problems in the bedroom, really, whether it's premature ejaculation, erectile dysfunction, that sort of stuff. And you do want to come in, particularly with erectile dysfunction, you do want to come in earlier than later. Erectile dysfunction is a barometer for your heart. I did a YouTube video called Morning Wood is a Vital Sign. Essentially what I'm saying is like your blood flow into your penis is a representation of your cardiovascular status. And erectile dysfunction is usually one of the first signs potentially of cardiovascular disease. In fact, it's an independent risk factor. Just having erectile dysfunction, you could be marathons, runner and healthy, but just having erectile dysfunction is an independent risk factor for having heart disease. So you want us to not only treat it soon so that you can get back to enjoying a full sex, life and having sexual wellness, but so that maybe we can change the course of would-be cardiovascular event, a would-be heart attack or a would-be stroke from occurring.
Yeah,
That's
that's
something
super important.
We bring up a lot too, that the barometer part, especially when we have like our community outreach kind of situations, because we do want to, we don't want to ask people how their boners are, but we definitely want to make them aware that that is a good thermometer to kind of let you know if that weather's going to be problematic or not for you potentially soon.
Right. Yeah. And we actually have seen, I know when we were in school, probably more so, and Cam was in retail right out of school, but I saw multiple situations where young men, like 25, 27, were coming into the pharmacy, or I had friends that were nurses and they were coming to their PCP saying, I've got ED. And you're thinking, well, you're way too young. And it turns out that they actually have maybe not a porn addiction, but they're watching quite a bit of porn and things like that. And they can't get it up. But, how do you kind of approach a situation like that where their erection probably works, but now this is like a mental health issue?
Yeah. So you're bringing up psychogenic erectile dysfunction. So within erectile dysfunction, there's organic, which means that there's some sort of blood flow issue. Biggest culprits or contributors: high blood pressure, diabetes, smoking, that sort of stuff. But then there's psychogenic ED. Psychogenic ED is kind of like performance anxiety. Some in partnered intercourse, whatever that looks like, it doesn't want to come to life. It doesn't happen. And it could be from a slew of, and it's from a potential slew of psychosocial issues or causes, right? It could be the person that you're partnered with you don't really like. You're not getting along with the other person in the bedroom. Okay, the relationship sucks. You don't trust them. You aren't attracted to them. You're not aroused. Okay, there's that. There's, you could be internally depressed, have self-image issues, anxiety, not just performance anxiety, but just general anxiety. So that could be issues. You could be grappling with your own negative issues around sex. Like if you were raised in a super religious household and now you're grappling with what does sex look like as an adult. I mean, these are just examples. Porn, it's interesting. I have seen a few patients like this, that, porn, I'm of the generation, I'm a millennial, what is it, ex-gennial, so I'm like a older millennial. So porn growing up for us, you had to go and get a VHS or a DVD. Like it wasn't at our fingertips like it is now.
Right.
Okay. Porn is at our fingertips, which means it's at the fingertips of boys. Okay. Of developing young individuals who have not yet had intercourse, real, in up close in life. And so there is data that shows like early porn watching and exposure can be harmful for our youth in particular. So you take a young man or a young individual who has been watching porn to masturbate since they were 9, 10, 11, 12, 12 years old. And we know that porn is typically an unrealistic representation of what partnered sex is. Okay. It's entertainment, right? So you've never engaged in real partnered sex, and you get off just fine. You get a great erection watching porn, masturbating, and that sort of stuff. But when it comes to like real partnered sex, which we know can be a little bit awkward, there's awkward pauses, there's the repositioning yourself. There's, it's not like, like porn, it can be potential cause of psychogenic ED. And I actually definitely have encountered a few patients like that, young men, and have counseled them to, that is a great, for multiple psychogenic ED, that's when you hope that your urologist advises you to see sex therapy. There are professionals, there are licensed professionals. It's not hocus pocus. There's licensed professionals that deal with a slew of sexual dysfunction, mental health issues, and it can do drastic improvement in your quality of life. So, yeah.
Yeah, I'm glad.
That's good to hear. That's like some of that good interprofessionalism that is luckily starting to become a big deal nowadays. You see a lot of the older doctors, older professionals, and they don't really they try to keep it in their own lane. They won't kind of refer or kind of go anywhere else. So it's really good to see everybody's kind of working together. Because I've actually had this conversation recently with some people where they were kind of like, oh, the sex therapists are just kind of saying the same thing, like everybody would already know, everybody should know. And it's kind of like you have to wake them up, like, no, like there are things that some people aren't aware of. There's some things people don't talk about or don't feel comfortable. So if you can get them to a professional who's kind of willing to break that ice, kind of shake them down a little bit and kind of get into that hard conversation, it does have a very beneficial outcome for these patients, and it is going to help them improve their lives, improve their relationships, and hopefully keep them away from these further conditions, because if they continue to ignore them, they're going to obviously take more effect, and then down the line they're going to be depressed, and then they're going to add on maybe weight issues, obesity problems, which will lead to more heart and diabetes conditions, because it can snowball really quickly. So it's definitely one thing we always want to push on the cast here, that this interprofessionalism, it's definitely not new, but it's definitely becoming big light, and that's phenomenal.
Yeah, more of us in medicine, especially in urology, that deal with it we need to do better. We have traditionally, like you said, not really been good at treating these problems holistically, and there are numerous conditions that I treat where I'm like, therapy, whether it's mental health therapy or physical therapy or all, both. And so I really I've taken a lot of time to get to know the sex therapist, to get to know the physical therapist in and around me. I want them to know my face. I want to know their face. I want to be able to tell a patient when I'm referring them, this is Dr. da-da-da-da-da, or this is such and such. She's licensed. She's, I know her personally because I've interacted with this person. So it's an important part of our job.
Yeah, that's got to be a good relieving feeling with your patients, that you have an nice relationship with the person that you're referring them to. I've been to docs with some of my clients where they're like, well, you can go to one of these 3 places and just let them know we sent you, kind of thing.
Yeah.
And it's like, it's okay. You might get a good service, but them knowing, all right, Dr. Milhouse knows where I'm going, and you've done a good job with them already. So the next professional is going to be able to pick up right where you left off and handle that stuff, which is really awesome. And I'm glad you refer to the mental health side of it too. It's like such a big deal now, and especially with men, that we've noticed. Guys, a lot of guys like to say they're really tough and all that kind of stuff, but really deep down, something that's embarrassing that might not seem like a big deal can really affect us. Guys throughout their whole lives. If you think about it, when we're like, 12, 13-year-old kids in middle school, like, how do you get a kid? Like, oh, you got a little dick, stuff like that. And then that kind of stuff you know, even when you're so small, it weighs on you. And then you get to be an adult, and let's say you have a embarrassing interaction, all that stuff comes back. So it's so good that you refer your patients to mental health help.
Yeah.
As we move on a little bit, I know that you talk a lot about, and you know, we're talking men's health, so we've got a little bit of a niche, and then even more niche. Let's on your Instagram page, I know you've discussed the racial disparities in healthcare. Let's talk a little bit about that, what that means to you, just so our viewers kind of become a little bit more educated on it. It's not something that we've hit on. We know it exists, but you've really had a lot of outreach on social media, so thought you're a great person to ask.
Yeah. So COVID kind of highlighted, it was kind of a reckoning of medicine far, far, far overdue, because it really exacerbated disparities, racial disparities, and Black and Brown individuals. And it made us look at medicine much more critically and really think about the vast array of medical conditions and the way we treat medical conditions and how there are healthcare disparities. And, a disparity is a disproportionately, usually negative outcome that is based on some demographic characteristic that shouldn't exist. Okay. So when we talk about disparities in white and urology, there are numerous, but the biggest one is prostate cancer. Okay. Black men are over 2 times more likely to get diagnosed and to die of prostate cancer, even amongst low grade or early stage prostate cancer. Black men are less likely to get definitive curable treatment than white men. So I talk a lot about that. There are other disparities. The Black men are, after prostatectomy, so after a cancer procedure to remove the prostate, Black men are less likely to get treatment for their incontinence. Incontinence is leaking urine unintended, which can happen after prostatectomy in a small proportion of individuals. And there are treatments that we can do for it, and Black men are less likely to get offered incontinence treatments. And I believe same goes for erectile dysfunction after prostatectomy. So I am a Black woman married to a Black man, for one, and I have Black children. And so I'm personally invested in healthcare disparities because it directly affects the community that I relate to, the community of people that look like me, or my husband. And so I would be doing a disservice if I did not, take on that mantra. Here I am, as a Black urologist, which is a small proportion in and of itself. And so bringing awareness to it, trying to educate. I come from a standpoint of, I want to educate the public. I want to empower the public. And so that's why I've made myself so visible. Part of my motivation for being Your Favorite Urologist, which just kind of developed, it wasn't a planned out thing, but I was like, I know I don't look like your typical urologist, and I want people to see that. And I want people to be able to relate to who I am, that I'm not this high and mighty doctor, this fancy schmancy urologist, this hoity-toity surgeon, but I am a human. I am, and I want them to, when people can relate first to who you are, then they are more likely to listen. They're more likely to take your advice. And I think a lot of the biggest things, especially in the Black community in medicine, is that the medicine has not earned our trust. And so getting the trust back, for good reason. Medicine has really done Black people dirty, but getting the trust back with the Black community that we serve in medicine it's going to take a lot of time, and it's going to take people like me who can relate to the community. And I see that not only in my social media interactions, but I see that in my patients. I have several patients who are like, I found you, I sought you out because you look like me, and I feel like I can talk to you more openly. I had a patient ask me a question. It was a very complicated patient, this Black man, very complicated. You see me for a second, an opinion, and he asked me a question, and I was like answering the question. He said, you know what, doctor, I didn't feel comfortable asking the question to the other doctor that he saw for this, who was non-Black. He was just like, I didn't feel comfortable. I felt like they were kind of talking to me condescending. And so it didn't make him feel comfortable asking that question. And here I am saying, and I'm telling him, you know, I want you to know going forward, I want you to ask any question that you feel like you need to ask to make the decision. This is your body. Okay. And before anybody does anything to your body, I want you to ask any question that you feel like it, whether you feel it's dumb or think it's dumb or not, or who cares what they think about it. But it's sad that is the way that individual felt with one physician who was a great surgeon, a great urologist, but just different type of interaction.
Well, yeah, I mean,
So do you find it more of an issue like when you have your patients come in? Do you find it to be like doubly more of a problem when they're like males and then they're coming in with like that race disparity, as you were saying, you know, where they've spoken to somebody else? Are they more reluctant at that point, or does it seem to be not necessarily more of a male problem, but more of like the disparity?
Okay. I want to make sure I understand your question. So are you saying, is it more of a problem because
hindrance is probably not a better word, hindrance. Like, are they more reluctant to talk to you? Like, is it like a compounding thing? Do you feel like where it's like the male side, they don't want to speak to the doctor already, and then now, like as you say, they're looking for you because you have the similarities with that?
When it comes to Black men, like my experience is they're very comfortable seeing me. The gender has not been, they're like, it's not nearly as important. It's not nearly as important as I feel seen by this Black provider and I'm Black. That is more, I think, the potential roadblock for them. And that is based on experience of being a Black man in America or in medicine. So for my interactions with Black men tends to be more instant comfortableness. Oh. You know, I'm, more instant comfortableness. And which highlights the need that we need more diverse workforce, more diverse physicians, more diverse professionals, medical professionals, because until the day where it doesn't matter what you look like and Black, people feel comfortable, brown people, Muslim people, gay people feel comfortable sitting in front of anybody, we need to make sure that we have a representative workforce that can meet the needs of our diverse and ever increasingly diverse patient population.
For sure. I know towards the end of pharmacy school, we had gotten a lot of education, and I think our professors had said, like, we had LGBT education, multiracial education. We had different breakouts where we worked with the medical students and had just instructions from people that were in the profession of different ethnicities and background, and some hiccups and things that they've kind of experienced along the way. And then also talking from patients. And so I think like we were really pumped that we got the education while we were in school and made aware of it, instead of a lot of people are just out there and then they're in this little, bubble that is like medical or pharmacy school that kind of looks a certain way. And then they get out there and like, oh crap, like this is very different than what we were taught.
Yeah. Yeah. And there's a lot of unintended harm being done from a lack of awareness of cultural competency awareness. And that isn't just racial, right? Religious, cultural competency, gender identity, and sexual preference, cultural competency. And so there's a lot of unintended harm being done from people from medical physicians who are not trained, who are unaware that these exist. It needs to be in the agenda curriculum of every healthcare professional school that interacts with, even if you don't directly interact with patients, it just needs to be a part of the curriculum.
Absolutely.
Mm-hmm.
Because I mean, just as a student pharmacist, I remember having, patient situations that I never even knew existed. I'm like straight up. I was like, oh, okay. And then you kind of look and you're figuring it out. And then you have to ask the regular pharmacist, like, I'm confused, whatever.
Mm-hmm.
And just as a student, though, I mean, we were exposed to it in real life situations. So, hopefully medicine changes quite a bit. And do you think there's an issue with like what questions to ask, like having understanding, or is it, some docs just flat out might not have great bedside manner. They come in, they treat you like the guidelines, and then they get out the door, right? So, I mean, there's probably a few different reasons that it's like this. And anything you can, pinpoint?
Yeah, I mean, I think I think we can relate to being in a conversation where we're talking to somebody who already feels like, they have a higher power than us. Like when you see the doctor, you're talking to this professional, right? And so you kind of feel like you're there to learn, they're there to teach, which is fair. But if you are if the environment feels like I'm being talked down to versus talked included, you see what I'm saying? You're not going to be engaged. You're not going to get more information out of that person. Okay. You're not going to ask those questions that are probably frequently asked questions, but you're not going to ask them. You're not going to so you're going to leave that scenario less informed than somebody who feels like they can be a part of the conversation with their physician versus being talked at. Okay. You're going to be less informed. And there is inherent bias, subconscious bias. Okay. We are humans. Okay. So time and time again. And I took what's it called? Implicit bias test. And I was biased. I was biased against, it was like Black women versus white women. And it was like, I was biased slightly against Black women. And you think, you're a Black woman, how are you biased against your own? Well, because we are a product of our heteronormative, male predominant, white predominant world culture. You see what I'm saying? Including me, and so it's a really, it's hard by Harvard. They have a ton of these implicit bias tests and they're free and you can easily take them. And it's enlightening because in the subconscious thoughts, when you see somebody that looks a certain way, that does dictate your actions. Am I going to be shorter with the patient that I deem less intelligent, that I deem is, oh, well, they're not as savvy, they're not as intelligent, so I'm just going to dumb it down for them and not give them the full information. You see what I'm saying? I mean, that probably happens all the time in Black and brown interactions with women patients, potentially, so that's just an example. And yeah, I mean, I think it's more about the implicit bias that the physician comes into the room with. And this is where a lot of the unintended harm is. It's not to say that we are bad people because we have implicit bias. No, you're human. We all have it. Refusing to acknowledge it is not, is being harmful, acknowledging it, learning about what your implicit biases are so that you can then make that subconscious thought conscious. Okay. And realize when I see a woman, I may feel like she is exaggerating her symptoms. That is an unfounded thought. That is not something that I should be thinking, let me think differently. Or when I see a man that XYZ. So if you can let those subconscious thoughts be brought out to the open, you can do something about it.
For sure. You just answered my question. I was going to ask you, since you took the
Implicit.
test, how does that
What-
change your practice? I mean, that's got to be eye-opening that you see something and you learn something about yourself that you never knew before, that you probably thought, just like you said, well, how can I have a bias?
Yeah.
Right. So like, was there anything else that really like changed the way you practiced when you found out this information, or you took more tests?
I figured I had biases. Like, I probably feel more defensive with like older white men, because I feel like maybe they aren't as trusting of me right off the bat, or they maybe be like, well, I don't know, so that's probably an implicit bias that I think I have, you know what I'm saying? And so my interaction may be a little bit more guarded at first, you know what I'm saying? So that's one thing that I've tried to subconsciously, like when I'm in the visit, I'm also, part of me is also like an observer, like, okay, Fenwa, what are you saying? How are you saying it? How is your facial expression? How's your body language? You see what I'm saying? But with the implicit bias test that I took with the white woman versus black woman, I was shocked that I was like, okay, well, I'm black. I'm a black woman. So yeah. And I was shocked that I was, I answered as commonly as probably most of us who take this test, that I was, biased against black women. So what it did was I said, you know what? I need to take my black women patients or whatever more seriously when they're talking to me, I want to be very diligent. I mean, that's with any patient, but I think it just made me listen more. I don't know how to describe it. You just listen more. And that goes a long way.
Yeah, I mean, listening is definitely a huge part of it, especially if you're aware of some of those biases or some of those, what are those, like hints and keys that you maybe do yourself. As you talk about, thinking about your facial expression, you're thinking about your body language, you're kind of aware of that. So that definitely will help kind of relieve a lot of situations for sure. And potentially maybe rectify some things if maybe like the wrong foot was kind of started off with, you might be able to kind of pull that foot back a little bit.
Absolutely.
It's awesome that like you're working so hard to help people find trust in healthcare again. I think that, when you hear about big pharma, I mean, you hear about it on the news and like we deal with it, big pharma a lot,
Yes.
Big pharma's kind of sometimes they're not your friend. So, there's a lot of bias that people have because now they hear there's a lot more news coming out about PBMs and what they do to customers. And I think people are starting to open their eyes a little bit more and be like, maybe it's not the providers either necessarily. Sometimes it's sometimes like the system that we operate in, but sometimes you have to. I mean, like you have to see a patient for a certain amount of time doing procedures. Like, there's ways that you have to manage your time in it as well. So I think that it's multifactorial as far as people, either getting along with the healthcare. And it also, how much do you advocate for yourself? Have you noticed that there's a difference in, racial or cultural differences in how much they advocate for themselves in the healthcare system? Do people just say like, this is the way it is and shut down? I mean, anything that you see as far as that goes in your practice?
I think empowered people feel more empowered to advocate for yourself. If you don't feel empowered before you walk into my door, you're not going to feel like you can advocate for yourself. And so who are empowered people? Well, empowered people inherently are, are white people, white men, because there is some privilege to being a white man. And so those, you see individuals more likely to advocate for themselves in that. But I'm seeing in overall, we're seeing patients overall, I think, feel more empowered to advocate for themselves. Okay. If we looked back 10, 15 years ago, it's, and we compared it to today, I think we understand, number one, medicine understands more that this is a partnership between the physician and the patient. Okay. This isn't a patriarchy. This isn't me telling you this is what I have to do. And I think too, patients are understand the importance of advocating for themselves way more than they did now. I think some people still struggle with how, but again, I think overall patients are more likely to advocate. They have choices, for one. Okay, well, I don't like this person. I didn't like the way they made me feel. I felt dismissed. I didn't feel heard. I'm gonna choose another place. And people and patients are really understanding that physicians may be good medical doctors, but if they don't have good bedside manners, that is going to affect their outcomes. So patients are seeking a better relationship with providers that have better bedside manners. So I see most of my patients now more than ever advocating for themselves better, but it's more of the the level of empowerment that patient feels coming in.
Interesting.
Yeah, I kind of find a lot of the empowerment, especially as come from not necessarily like an understanding or knowledge base, but at some level you need a little bit of I don't want to say leeway, but kind of like give and take for it, because there are like several ways, the old adage, several ways to skin a cat. There are several ways a lot of providers can go about treating a condition, finding a condition, things like that. And then sometimes it does take that, unfortunately, trial by error to kind of figure out what it is. So a lot of depression is like one of those big ones where there's several avenues for medications, several therapies, and several options. And unfortunately, it is one of those ones you do have to find the right therapist. Therapists aren't plug and play. Unfortunately, you have to try many plugs before one can play. And then at that point, they may want to initiate a medication, and that can go back or forth. Maybe you don't want to, so now it's another therapist. Or if you do, now you got to try which kind. Do you want an SSRI, an SNRI? What kind of profile are you looking for? And I know, especially when it comes to like the veteran population, that being kind of my base population, is that they're kind of grumpy. They're kind of grumpy turds. Like they expect that solution to be pretty quick, and they don't realize, and they're not really willing to kind of give you that leeway. They will argue up and down all day about things. And they just don't quite grasp that it can't be automatic solution. So yeah, you're coming in, you're having issues with, your penile issues, you're having, enlarged prostate concerns, and it can't just be next day you're good as new. And that's unfortunately what they expect. So luckily, with, as we talk about, the younger generations are kind of a lot more open to this. They're a little more understanding, and the research online, albeit, is a lot better for them to kind of go through. They're definitely coming out to be a little better of a population group, and they're helping that partnership, as you'd mentioned. They're understanding this is not the doctor working on me like a car. This is us coming together, and we need to be a team, including our other medical personnel, to kind of come to a solution on that. So luckily, we're getting, step by step, each generation is becoming slightly better.
Agree.
Yeah, we've even noticed we do a lot of community outreach, go to car shows, different events, sporting events, things like that. And we've noticed that guys are a lot more likely to come up and talk to us about their mental health.
That's awesome.
Like we started noticing it probably here about a year ago. We did a car show. One of my friends has like a farm, and she started doing car shows on it. And there were some guys that came up, and they're asking us, oh, what's the podcast, all this stuff about? And we started talking about mental health, and like, oh man, that's awesome. Like such a great resource and things like that. I think we got some listeners off of it, which is pretty cool. But just seeing how men are feeling a little bit more comfortable. And I think there's different avenues out there that are kind of acknowledging men in healthcare, and just to be a little bit more proactive about things that really are treatable. I mean, a lot of issues in men's health, if you catch them early, the turnaround time is much quicker than if you wait for a period of time and now you're dealing with all kinds of stuff. So it's important, guys, know. Catch it early.
Mental health is a really important part of men's health that we, and Men's Health Month, that we need to hone in. And I'm glad to hear that. I too feel like I have seen a better response to my men patient when I suggest they should get therapy. Before, previously, it'd be like, okay, don't be offended. I think I want to refer you to a therapist, and automatically like dismissed and bluffed. Like, what is that gonna do for me? I don't need to talk to somebody. Now, especially, I'm so happy. Like most of the time when I bring it up, they acknowledge that you're probably right. Dr. Milhouse, seems like a good idea. They're much more receptive, which I love. It's just creating healthier men. Overall, healthier men are important for our community, important for your family, for the community at wide. I mean, mentally and not just physically strong men, but mentally mature and strong men. I think it's hella dope. So yeah.
Oh yeah, men. And then, all you guys out there, you got to fill your cup to be able to. And I think a lot more guys really want to be able to be like provide and give and do these things. But I think that sometimes mental health and physical health and the issues will kind of catch us up here. And then we're really, I think, a lot of us are stuck up here. And it's not allowing, general, up until recently, like more and more men can now, I think they realize like, self-care is important. Going to the doctor or going to therapy is important. Now I do things that fill my cup so that I can go back out into my community and fill it up. And then, but you also have a place to go back to refill. I think that's what's important. And so it becomes a symbiotic relationship with men. And that's what we're excited to kind of hopefully be a part of this tide turning. So men are taking better care of themselves.
Absolutely. You live longer, better husbands, better partners, better parents, better community leaders, better at work. I mean, I think it's the backbone of our community, of locally, globally, are men, and we need mentally strong men that can be vulnerable and can, again, like I like the way you put it, fill up their cup. Because we all need to have that. We all need that.
For sure. So
yeah, we're heavy into men's health, obviously based on the podcast nature itself, but like it's something that I hope a lot of our listeners kind of chime into as well, that it's not just men's health, it's your family's health. As you just talked about partners and parents, you have your wives, your brothers, your boyfriends, you have your kids, sons, daughters, you have your moms, dads, uncles, you have family all the way around you. And if you're closed off, if you kind of keep this older mentality, this old school mentality, that you don't need this kind of help, you can take it and by yourself, you're setting like a precedent. You're kind of putting like a weird vibe onto everything. But if you're being more open, you're seeing your therapist, you're working with your doctor to help solve your problems, you're setting the example, you're showing that there are things you can do to improve yourself. And by improving yourself, you're going to improve your relationships. You're going to improve your parenting style. You're going to have good relationships with your kids, where you'll get to live that movie kind of lifestyle where you're growing old and you're seeing your grandchildren. You're seeing, you and your wife are in a tub on a porch overlooking like the mountains for whatever reason, because they have porch tubs. But like you're building this family unit, this whatever, however you may want it to be, you get that opportunity to build it. Because we all kind of think historically, you think about the 50s and 60s lifestyle where obviously times were very different back then, but like the father is like always portrayed as like a hard kind of like authoritative figure, and the kids won't discuss anything. They'll go to their mother first and things like that. So we're kind of rewriting how these units are going to be. And that first step is making sure that you are taking care of yourself. If you want to take good care of your family, you need to make sure yourself is also like doing well, you're tuned up, and you're in that right mentality.
Yep.
Couldn't have said it better myself.
Yeah, very well stated.
So Dr. Milhouse, as we wind down a little bit, what is your favorite thing to treat, or a favorite procedure or something like that? Because I know you have some OR, clips and things like that. What's your favorite thing to treat?
Okay. One of my favorite procedures in the office is a vasectomy. It's easy. It's I get to play music, talk to the patient. It's just fun. I don't know how to describe it. People are gonna be like, why do you think it's fun? I don't know. It's just fun. In the operating room, gosh, there's a lot of things I do that are favorites. I love, so I don't just have one. I love using a machine called the robot. Robot is a technology we use in medicine to do what we call minimally invasive surgery. So instead of opening you up with this big long incision, we can do very tiny, small cuts and use telescopes that are controlled by these robotic arms, and we can see it up close into tight spaces, into your belly, your pelvis, wherever, and see 3D. We get to sit down and operate, so that's always great. Like, instead of standing up, I get to sit down and I get to like look in this thing that shows me inside your body. It's 3D, it's magnified. I'm using these like game controller things, which knock out any human tremor, meaning my movements are super smooth. And it makes surgery, it makes doing a range of procedures that we do as urologists. We do a lot of procedures in the pelvis, which can be pretty painful the old-fashioned way. It makes that now a very pleasurable experience. So I love doing robotic procedures. I love doing prosthetic urology. What does that mean? There's two different prosthetic devices that are commonly used in urology. One is an inflatable penile prosthesis, or IPP, and that is basically used to get an erection, used to create a rigid penis. This is for men or individuals, penis owners, who have failed other things for erectile dysfunction and nothing's working. And here at the end of the day, we can get I always tell a patient, at the end of the day, we can get a stiff dick, and virtually anybody. An IPP is the way. It's a surgery that we do to implant this inflatable penile prosthesis that inflates. I like doing that. Has a huge success rate and patient satisfaction rate and partner satisfaction rate. So it's really great to be able to restore that in an individual's life. And they can get a rigid penis whenever they want, as long as they want. Like, that's totally spontaneous. And then the other prosthesis that I like to do is called an artificial urinary sphincter. And that's where I'm implanting this. It's for men who have incontinence with cough, laugh, sneeze, exercise, run, jumping, something called stress incontinence. And men who have stress incontinence is, in the general population of men, is not as common, but the biggest risk factor for male stress incontinence is having a prostate procedure done. Okay. And I just kind of hinted to this, a radical prostatectomy or surgery for prostate cancer. There is a risk for this stress incontinence to develop. And so most of the men that I'm doing it are in this category. And so, they beat cancer, they're cancer survivors, but now their cancer survivorship is being affected by this new leakage, and they're wearing pads, and that does something on obviously your self-confidence, and it's a huge impact on their quality of life. And so I get to do this surgery to implant this artificial sphincter. It looks like a blood pressure cuff, a mini blood pressure cuff that wraps around the urethra. And so it squeezes it and keeps it from leaking. And then when the patient wants to pee, they just push this pump that's in their scrotum, that's discrete in their scrotum, and it relaxes this cuff, this blood pressure cuff, so their urethra can go, and then it re-squeezes it. So I get to do that surgery, and for many men, restore a level of dignity that they may have felt that they lost after surviving prostate cancer, or just having incontinence in general.
It is almost like wild to think about, like, how much our male healthcare is wrapped on our egos. It's definitely sad. Like, I understand it, but it's definitely sad. But also to kind of iterate your point with the robot arms, that's actually something I'm getting into as well. So nuclear pharmacy has two paths. We have low energy, which is called SPEC, and we have high energy, which is PET. And I do high energy. So we also have like the robotic arms you use to manipulate the radioactive drugs and stuff, just because we need an extra level of safety from that. And it is something that is really cool. Like, if you're used to working in the hood, you have your hands behind leaded glass and you're pulling doses and things like that. It is something different. Just have your hands in these arms and you're just kind of out there manipulating these things. So it is really cool. So I definitely am fully with you on that.
you can't afford to spill a drop. So I guess they said the robot is doing it, not you. So yeah, that's dope.
Yeah.
That's cool.
It's more of we don't want to clean up those drops when they're spilled because it's
Yeah.
people
Yeah.
get a little pissed about it.
Yeah.
For sure. Well, Dr. Milhouse, it has been an absolute pleasure having you on. Where can our followers and viewers get a hold of you?
Yeah, I love Instagram. That's my main platform on Instagram. I'm Dr. Milhouse, and that's Milhouse with one L, Milhouse, which I don't know. I don't think that's the way that Milhouse on The Simpsons spells it.
No.
But yeah, Dr. Milhouse. If you just search Your Favorite Urologist, you'll find me. I am Your Favorite Urologist on TikTok, my other favorite avenue. I also do have a YouTube video with educational videos just about every Wednesday, and that is at There Urology. And if you are in and around the Chicago area, or even if you're not, and you need a urologist and you want to see me, you can see me. I have my own practice now. Very, very proud of that. I started my own practice with my partner just over 6 months ago. It's called There Urology. Super easy to remember. And it is based in the Chicago and surrounding north suburbs of Chicago. So
awesome. Congratulations on the new practice.
thank you.
That's a huge deal. So
huge deal. Yeah.
awesome
So
stuff.
any of our listeners in the Chicago area, you need to go and sign up to get down that patient list there.
Yes. Yep.
All right, Dr. Milhouse. Well, it was a pleasure. And hopefully we'll have you on soon. You're welcome anytime. Thank you so much for your insight and all your knowledge in urology and beyond.
And thank you for everything you do for all the patients and then now our listeners.
You're welcome. Thank you, Patrick. Thank you, Cam. I am happy to be back anytime.
Awesome.